Back in the 90s, Medicare beneficiaries had far fewer choices than they do today. For example, there were no Medicare Advantage plans in the form that we have them now. The only choice for people with no retiree coverage from a former employer was to enroll in Original Medicare and add a Medigap plan to help them cover their deductibles, copays, and coinsurance. Fortunately, Medicare beneficiaries today have more choices. They can opt to get their Medicare Part A and B healthcare services through a Medicare Advantage plan. And many of them do, with approximately 42% of them choosing Medicare Advantage plans today. But which one is right for you? Original Medicare or Medicare Advantage? In this video, I'll discuss both options and share a few tips to help you choose the right plan. Under Original Medicare, you get your benefits directly from the federal government. Original Medicare benefits include two parts, Part A and Part B, that provide your hospital and medical insurance. If you have a qualifying work history, your Part A benefits are premium-free. Medicare Part B premiums are set each year by the federal government, and most people pay the same standard rate, which is $170.10 in 2022. Some high earners pay an income-related adjustment in addition to the standard premium. Because Original Medicare is managed by the federal government, the benefits are exactly the same for every person who enrolls. There are no pre-existing condition limitations and no waiting periods. Part A covers inpatient care while you are admitted to a hospital or a skilled nursing home. It also covers hospice care and certain kinds of home health care. Part B pays for outpatient expenses like doctor visits, x-rays, and lab tests. It also covers durable medical equipment like wheelchairs and home oxygen supplies. Under Original Medicare benefits, you can use any healthcare provider who accepts Original Medicare. This includes over 1 million providers nationwide. There are no networks. You pay the same amount for covered services from any of these providers, no matter which one you visit for your medical care. Original Medicare does not cover outpatient prescription drugs, though. You can enroll in a standalone Part D drug plan for that coverage. Think of Part D as an insurance card that you use only at the pharmacy. Part D drug plans are offered by private insurance companies, but they are regulated by Medicare to ensure that all plans meet certain minimum requirements with their drug formularies. If you choose to stay with Original Medicare, you need to know that there is no limit to how much you might pay out of pocket each year. For example, if you need chemotherapy, your 20% coinsurance responsibility could be an awful lot of money. For this reason, most people who choose Original Medicare will also buy a Medigap plan. Medigap plans pick up where Medicare leaves off. They step in to pay the deductibles, copays, and coinsurance that you would otherwise have to pay yourself. Most people who choose Original Medicare plus a Medigap plan value freedom of access to Medicare's entire list of providers. Medicare offers the ultimate flexibility for you to treat with any provider that accepts Medicare. Since there's no need to choose a primary care provider, you do not have to get a referral to see a specialist. This kind of flexibility is appealing to many people who travel frequently or live a snowbird lifestyle because they can see doctors anywhere they go. Other people choose Original Medicare and Medigap because they want very predictable back-end costs. They want the peace of mind that comes from knowing exactly how much they will spend on a hospital stay or a chronic illness. They buy for convenience and don't mind spending a bit more to gain peace of mind. Sometimes people also choose Original Medicare if their doctors do not participate in any of the Medicare Advantage plans. Doctors have their own reasons for choosing not to participate in Medicare Advantage network sometimes. If yours doesn't, you'll have to decide whether you want to keep Original Medicare and pick up a Medigap plan so you can keep seeing that doctor, or whether you are willing to change to a new doctor who does participate in the Medicare Advantage coverage. Medicare Advantage plans are very similar to group health insurance that you've had during your working years. These plans have networks, and you pay for medical services as you go along. You must be enrolled in both Medicare Part A and Part B to enroll in a Medicare Advantage plan. Medicare Advantage is also known as Medicare Part C, so it's technically still a part of Medicare, but plans are not offered directly by the federal government. The government sets rules and guidelines for Medicare Advantage, but private insurance companies sell and administer these plans. Medicare pays the insurance company to administer your Part A and B benefits through the Medicare Advantage plan. While all plans must cover the same healthcare services as Parts A and B, different Medicare Advantage plans will have different networks, copays, and drug formularies. Medicare Advantage plans also do not require any underwriting. Since there are no health questions, it's very easy to obtain a Medicare Advantage plan if you live in the plan service area and are enrolled in Medicare Parts A and B. There are several different types of Medicare Advantage plans. The two most popular Medicare Advantage plan networks are HMO and PPO. HMO plans have closed provider networks, and you generally must get all but emergency care within your plan's network. You choose a primary care doctor who oversees all of your medical care. Your plan may require you to get a referral for a specialist care and obtain prior authorizations for certain tests and procedures. HMO plans often include Part D prescription drug coverage rolled right into the plan. PPO plans also have provider networks, but you can still use any provider that accepts Medicare and is willing to bill the plan. However, treating with providers who are outside the network will generally cost you more out of pocket. With a PPO plan, you usually don't have to choose a primary care doctor or need a specialist referral. Many of these plans also include Part D coverage. Now, all Medicare Advantage plans have to offer the same healthcare services that you would get under Original Medicare. However, many go beyond and offer other coverage like routine vision and dental care to their memberships. Some even have wellness programs, gym membership discounts, and 24-hour nurse hotlines. It's difficult to give a snapshot of your costs with a Medicare Advantage plan because each one is different. Each company that offers a plan can choose what to charge you for premiums, deductibles, and copay amounts. You may have heard of a zero premium Medicare Advantage plan. A zero premium plan simply means that the plan doesn't add any additional premium above what you are already paying for Part B. For 2022, the average Medicare Advantage plan premium is about $19 a month, but in many urban areas, you can find plans with zero premiums for you to consider. Some Medicare Advantage plans have deductibles and others don't. Deductibles may apply to inpatient services, outpatient services, or to Medicare Part D. About half of all Medicare Advantage plans with Part D benefits don't have a Part D deductible, so if drug spending is anticipated, you can try looking for a plan in your area that has no drug deductible for you to satisfy up front. This is a good thing since the Part D standard benefit has a $480 maximum allowable deductible in 2022. However, you may find that plans with the lowest monthly premiums may have drug deductibles built in. There is a trade-off here, which is why it's so important for you to work with an experienced broker like Boomer Benefits to help you choose a plan that has the right balance of cost versus benefits. Medicare Advantage enrollees usually pay a copayment when they access healthcare services. This is usually between $10 and $50 for doctor visits and up to $75 for emergency room and urgent care visits. There is often a tiered copayment system for prescription drugs under the built-in Part D drug formulary. Generic medications have lower copayments, often in the $3 to $5 range. Brand name medications and specialty drugs have higher copays, of course. There is one very important difference between Original Medicare versus Medicare Advantage. When you have Original Medicare, there is no limit to your out-of-pocket expenses unless you purchase a Medigap plan to pay those expenses for you. Within a Medicare Advantage plan, you can't purchase a Medigap plan to pay your out-of-pocket expenses. You yourself will pay any copays, deductibles, and coinsurance. For this reason, Medicare Advantage plans are required by law to build in a maximum out-of-pocket cap, or MOOP, on your potential spending. Once you hit your MOOP, you pay nothing for covered Part A and B healthcare services for the rest of that calendar year. In 2022, the mandatory maximum out-of-pocket limit for Medicare Advantage is $7,550, but many plans choose to set theirs lower. Choosing a plan with a lower maximum out-of-pocket limit means your spending will be capped sooner, and that's good for you. So which type of plan is better for you? Original Medicare or a Medicare Advantage plan? Everyone's situation is different, so it's tough to give a standard answer without knowing the details that are most important to you. Both types of coverage offer reputable Medicare insurance. You just need to consider the total cost, such as premium, deductible, coinsurance, and copayments, and your healthcare needs to get a clear picture. Many people are drawn to Medicare Advantage plans because of those lower premiums. However, if you encounter a serious or chronic health condition, you can sometimes incur some heavy spending each year before you reach the plan's maximum out-of-pocket limit. Always make sure to have some money set aside to help you cover your copays and coinsurance in the event that you develop a chronic illness or have a year with heavier medical usage. For people who travel often, the restrictive networks with Medicare Advantage could be a deterrent. If you like to head south to escape the cold each winter, Original Medicare will certainly provide you more freedom of access to all the providers while you travel in the United States. Paired with a Medigap plan, your out-of-pocket costs under Original Medicare will be much more predictable. It's also easy to find providers since Original Medicare's network is nationwide. In the end, it's a good idea to visit a reputable Medicare insurance broker like us here at Boomer Benefits to see what plans are available in your area before you decide. That way, you can compare costs and benefits and see which option works best for you. There may be some things to consider that you have not even thought of. We'll go over the pros and cons of Medicare Advantage plans versus Original Medicare for you. We'll help you estimate your total Medicare spending. We can also ensure that you use the proper election periods for your Medicare enrollment process to avoid any unnecessary late penalties. To learn more about the features, pros, and cons of Medicare Advantage plans, watch this video next.